Good afternoon. Welcome, everyone. Thank you so much for joining this month's Fireside Chat in honor of Skin Cancer and Melanoma Awareness Month. So the Fireside Chats are brought to you by the Office of Community Outreach and Engagement at the Masonic Cancer Center at the University of Minnesota. So the Office of Community Outreach and Engagement serves as a bridge between the Cancer Center and communities across the state of Minnesota. Our team's mission is to reduce the burden of cancer in Minnesota by engaging communities and providing them access to knowledge and information on the latest cancer research, cancer prevention, the importance of screening and early detection, treatment options, survivorship, as well as clinical research opportunities. My name is Amna Hussein, and I am the Community Engagement Coordinator on our team. And on behalf of our team, thank you all so much for joining us today to help us raise awareness about skin cancer and to learn about the measures we should all be taking to protect ourselves and our loved ones as we approach our summer months. So it is now my pleasure to introduce to you all our speaker today, Dr. Rachel Vogel. Dr. Vogel is a cancer epidemiologist and associate professor in gynecology oncology at the University of Minnesota Medical School. She is the Masonic Cancer Center Women's Health Research Scholar. Dr. Vogel has a focus in outcomes research and strong interest in cancer survivorship. As the number of cancer survivors increases, the long-term effects of the disease and treatment have become a substantial public health concern. Dr. Vogel's research focuses on identifying issues patients face once they are diagnosed with cancer and test interventions to improve quality of life and outcomes. She has a particular interest in supporting melanoma survivors and has a grant from the American Cancer Society to test whether a wearable device that tracks sun exposure and provides alerts regarding sun exposure and protection behaviors will increase on protection behaviors in melanoma survivors. And she will actually be talking a little bit more about this research during her presentation today. So we will be recording today's session, so you can refer back to the recording on our YouTube page. We will edit out the recording to ensure your privacy. And before we get started here, if you're just joining us, please take a moment to locate the mute and chat buttons. I know we've all probably heard this so much over the past 2 years, but I think it's good to go over it again. So during today's presentation, please use the chat box to submit your comments or questions, or you can send them directly to me. Following Dr. Vogel's presentation, during our discussion portion of the fireside chat, you will have the opportunity, if you would like, to unmute yourself and ask questions. And so without further ado, it is now my pleasure to introduce to you all Dr. Rachel Vogel.
Thank you, Amna. Let me get this started. And all right, perfect. So today I'm going to be talking about skin cancer. I want to focus on prevention, screening, and then share with you some of the latest research that's going on. I do want to say a one disclaimer is that I am not a dermatologist. And so just please remember, I'll probably say that about 3 times, but please try to remember that as we're talking through. So, you know, everything that I'm sharing with you is really from my research perspective. So let's get started. So I think, you know, to me, I know this stat, but it still surprises me every time I see it. You know, more people are diagnosed with skin cancer every year than all of the other cancers combined. And so this really is something that we need to care about. And you know, and is preventable in a lot of cases, but we really have not made a lot of progress, particularly in the United States. So what is skin cancer? You know, somewhat self-explanatory, but you know, it's a cancer that arises in our skin cells. There's 3 main types. So basal cell, squamous cell, those arise in our basal cell and squamous cell. If you see my pointer, here at the top layers of our skin. And then melanoma is the one that we are really most concerned about, particularly because it has the highest mortality, especially if it's caught at a later stage. And that arises from the melanocytes, so a little bit deeper in our skin. And so why do we care? Again, I think I just told you, so from a skin cancer perspective, we care because this is just happening a lot. But for melanoma in particular, which again, I said is this, you know, more fatal, you know, really serious skin cancer, it's the number 5 cancer in the United States. And so about 100,000 people each year are diagnosed with melanoma. And unfortunately, that is going up, and it has been going up for the past few decades. So a lot of other cancers, we've been able to curb them, and their incidence is either flattened or come down. But the number of new cases of melanoma continues to rise every year. And so this is something that we're certainly concerned about. And even more so, we're concerned about this here in Minnesota. And so, a lot of times when we talk about something being in the top 3, that's a good thing. In this case, it's not. So melanoma is number 3 in terms of melanoma incidence. So the number of new cases of melanoma diagnosed in Minnesota, that's the top 3 in the country, behind Utah and Vermont. And so this is something, not only should we care, globally and in the United States, but this is really a problem here in Minnesota as well. I know a lot of people always ask me why Minnesota. I think particularly it's really interesting actually that Wisconsin is number 21, right? So it's not, I think it's partially our racial makeup, but it's more than that. I think it's also because as a state, we're actually generally pretty healthy, and that's a good thing. And that means that we're more physically active, and generally speaking, we're getting outside a lot more. So we're hiking and swimming and cabin life, and all of those lifestyles are great, but they contribute to our risk. The other piece of that, the other healthy piece of that, is that we're also more aware of melanoma, and so we're doing more screening. And so you can see that the mortality has stayed pretty constant, even though our incidence has gone up. And that's because we are carefully screening and we're catching these melanomas early. So all of those things are contributing to, in Minnesota, we have an issue with melanoma. So what are the risk factors? I think most of us know, I divided these into non-modifiable, so things we can't change, and then modifiable, the things we can change. And that really is that ultraviolet radiation exposure, which is primarily from the sun, and also indoor tanning. So I think we all kind of know that is what is happening, and that's attributing, most, over 90% of melanomas and skin cancers can be attributed to UV exposure. But there are other risk factors that also I want to make sure that you're aware of. So moles, the more moles that you have, the more likely you are to develop skin cancer. Fair skin, freckles, light hair, again, put you at greater risk for melanoma. A family history of melanoma or a personal history of other skin cancers increase your risk for melanoma. So we know that there are some genetic risk factors for melanoma. And then also a weakened immune system also puts you at a higher risk for skin cancer. So for example, solid organ transplant recipients are at higher risk for skin cancers. Okay, so what do we do? In my world, most of my research focuses on survivors, but I would love if they never even got to that point, right? So ideally, we prevent as much of these skin cancers and melanomas as we can. Okay, this is going to be nothing new to anybody here. There's a lot of different things that we can do to improve our sun safety, and that's the way I really like to think about it. Think about sun safety. Think about ways that, even if it's just a little thing that you can do, that will make a difference over time. So the recommendations that are given to everybody, regardless of your risk level, are to wear a hat, use sunglasses, wear clothing, seek shade, go in the shade as much as possible, whether that's an umbrella, under a tree, avoiding peak hours. So the peak hours are generally considered from 10 a.m. until 4 p.m. During that time, that's when the UV is the strongest. So I tell people, if you love to golf, maybe you do an 8 a.m. tee time. That can really change the level of sun exposure that you have. And then lastly, and I purposely am talking about this last, is sunscreen. I really, if you leave with nothing else today, I would love for you to leave knowing and thinking about sunscreen as the second option. Ideally, you're doing all of these other things, and the sunscreen is just your backup plan. And I have a few reasons for that. One thing I do want to just make really crystal clear, though, is how important all of these behaviors are for everyone. So not only those that are at particularly high risk for skin cancer, but also individuals, people of color, and really we are all at risk for skin cancers and melanoma. And I wanted to share a quick anecdote with you. So I spoke about skin cancer prevention at the Melanoma Research Alliance last 2 or 3 months ago. And as we were talking through all of these measures, things that people can be doing, a gentleman in the back, a melanoma survivor, a Black man, stood up and he said, okay, wait, so what am I supposed to be doing? What you're talking about is what white people do. and so, we all, I was on a panel with a couple dermatologists, and we all said, no, the advice is exactly the same for everybody. You might have slightly different levels of risk, but he was proof that, regardless of your skin color, you are at risk for melanoma. So really these prevention, all of these prevention modalities apply for everyone. And so back to sunscreen, a few reasons why I wanted to encourage you to think about it as secondary. One, it's more expensive than many of these other options, but two, most people don't actually use it correctly. So to use sunscreen correctly, you have to use a lot of it. And so I wanted to show you here. So ideally, you would use 1 teaspoon for your face, 1 teaspoon for your neck, 1 teaspoon for your arm, each arm and leg and front. So you can imagine that a bottle of sunscreen, if you're using it correctly, is going to go really fast. And not only that, but you have to be really careful about the timing and reapplying, right? So a lot of people are maybe good about applying that sunscreen, but they're not necessarily reapplying. So first, it's supposed to be on 30 minutes before you go outside. That's particularly relevant for the chemical sunscreens. So if you put on, I am guilty of this, where I'm ready to go outside and then I put the sunscreen on. That's not as effective as if you put it on and wait. And then it needs to be reapplied every 2 hours or after sweating and swimming. So again, you can imagine here that most people are not using sunscreen correctly, which is why wearing a long sleeve shirt, for example, is a much safer bet. Excuse me for 1 second. So I just want to kind of summarize this prevention with a few practical tips. One, the safest way to avoid the sun is through timing. So again, making sure that when you can, scheduling your outdoor activities maybe early morning or later in the evening, and using clothing. And that again, using sunscreen should be together with some of these other measures that I talked about. Ideally, I think for all of us, when something is a habit and it's routine, we're way more likely to do it consistently. And so that is what I would argue, make your sun protection routine. You include, when you put your face lotion on in the morning, make sure that includes some sunscreen and SPF. You have hats in your car so that whenever you go somewhere, if you're going to a soccer game with your kids or whatever you're doing, you have that hat available to you and it's just part of your routine. And then I really want to reiterate that it's never too late. So it doesn't matter if you are 20, 40, 60, 80, you are still at risk for melanoma, and you can reduce your risk by reducing your sun exposure. So it really is never too late. And one common myth that I hear very, very frequently is, most of my sun exposure happened when I was a kid. I got sunburns. There's nothing I can do now. And that's not true. So up through 18, you've had less than a quarter of your lifetime sun exposure. So really, there's a lot of years and a lot of life, sun exposure left, even after you reach adulthood. So please, no matter what, continue with your sunscreen or your sun safety behaviors. So next is screening. And again, screening is something that is really important for skin cancer, particularly melanoma, because if we can catch these cancers early, then your chances of dying from melanoma in particular are much, much lower. So if it's caught in stage 1, that is generally like over 95% chance that you will live beyond 5 years. Stage 4, where the melanoma has spread to your lymph nodes and spread to your other organs, that rate is less than 50% living beyond 5 years. So significant difference in when you catch melanoma. And so that's where screening is especially important. So I think one of the ways that we talk about screening is the ABCDE method. So this is how you can watch moles in particular yourself. And what you're looking for is asymmetry. So a mole that is not symmetric. One side looks different than the other. Border, B for border. Here you're talking about something that has an irregular border. So like this example here. So it's not, a nice clean circle, for example. C for color. Here we're looking at, does the mole have a new or a different part that's a different color from the rest of the mole? D, diameter. So skin cancers tend to be larger. So you're looking for moles that are larger. And E, and I would say this is the most important, is evolving. So you're looking for moles that are changing. So if a mole is changing, and really if you notice any of these things, but in particularly if a mole is changing, then that's a time to reach out to a dermatologist. And so I can't talk about screening without talking about skin examinations, both doing it yourself or having a partner doing it and with a dermatologist. And here there's some graphics walking you through. Really, it's more than just checking your arms and legs. Make sure that you're being really thorough. People that are at particularly high risk for skin cancer or melanomas are recommended to do this monthly. I would say even if you're doing it a few times a year, that's really helpful. Have a partner or a friend or somebody helping you check your back. And then in particular, especially for people of color, to be checking places where the sun does not shine. That's actually really, really important. Checking your feet, the soles of your feet, in between your toes, under your fingernails. There is a type of melanoma that's not caused directly by UV exposure that happens to be more common in people of color. And so it's really important, again, to catch these cancers as early as possible. And so finally, I want to tell you a little bit about some of the research and what we have going on, where the state of the research is right now, related primarily to prevention and screening. So for screening, there's really cool stuff using new technology, which I think is probably not a surprise. So I know at least one participant asked a question about how do you track these moles? Particularly, some people have quite a number of moles. How do you track that? What I would recommend and what the latest research is all about is mobile apps that are created that help you take pictures and you can follow these moles over time. So that is really effective. And a lot of dermatology clinics are actually working with those apps together with patients. So that's a great way to track your moles over time. And then another piece that's really evolving, I would say it hasn't stuck yet. There's a lot of technical issues to work through, but the idea of artificial intelligence, and that is meant to really complement what the dermatologists are doing. So it's not uncommon to hear a story of somebody who felt like they had a suspicious mole, went to the dermatologist said it was fine, and a few months later figured out that it's cancer. That doesn't happen a lot, but it does happen. And the thought is that artificial intelligence, so using technology, using a computer really, to look at those moles, look at those lesions, and that would help supplement or complement what the dermatologist is seeing. So they might, using this technology to identify cancers. And I think the long-term goal is that you could use this as a first step of screening, but right now it isn't quite where they would want it to be, and it's you can't at this point, you definitely can't replace a dermatologist. So that's kind of the what's going on with screening right now in terms of the research space. And then prevention, a lot of the work has really right now is focused on families. So understanding that there's family risk factors and family risk related to skin cancers. And so if we can intervene early, right? So if we can work with adults with young children, and the adults are working on their sun behaviors, and they're also teaching their children about sunscreen and wearing hats, and that is becoming part of their routine, that has the possibility to play huge dividends in the future. So that's where a lot of the intervention work is focusing. There's also some really cool work that is using social media to reduce indoor tanning. So indoor tanning, thanks to work of Dr. Dan Lasovich and a lot of others, We know that indoor tanning is a really significant risk factor for melanoma. And so we have done a lot of work through legislation and promotion to try to reduce indoor tanning, and social media is kind of the latest avenue for that. In particular, the two main groups that use indoor tanning are young girls, young women, and then actually homosexual men. And so we've been working a lot to try to figure out how to best reach these populations. And social media has been a really good avenue for that. And then finally, I want to talk about a little bit about the research that I'm doing. So as I said, I'm really interested in melanoma survivors. And so once you've had a melanoma, unfortunately, you're at almost a 10 times greater risk of having a second melanoma. So thinking back to that Melanoma Research Alliance retreat I was telling you about, there's a woman there that I see every year, and she is up to 5 melanomas at this point. So she has had numerous new primary melanomas. And so when I think about her, I think she's clearly at really high risk for melanoma. What can we do to help melanoma survivors reduce their risk of another melanoma? And so that is where I have done a lot of work over the last decade to try to understand what melanoma survivors are doing in terms of their sun behaviors. So many of them change their behaviors, start wearing clothing, use more sunscreen, all of those things. But there's actually a group of people who don't. And there's people who, about 20 to 30% of melanoma survivors still report sunburning annually. And about 10% still report intentionally tanning. And there's always a few that report indoor tanning still. So we still have some work to do. But what I heard most frequently when I talk to melanoma survivors is not as much the intentional tanning, but more the incidental exposure. So they were at a soccer game and then another soccer game happened, and all of a sudden it's 3 hours later and they're burned. Or they went for a bike ride and they were feeling really good, so the bike ride extended and then their legs are burned. So these things where it wasn't intentional, they're not aware of how much sun exposure they're actually receiving. And so there's new technology, think of like an Apple Watch, something like what I'm wearing, that can measure your UV exposure and then sends messages to your phone letting you know as you accumulate more UV, hey, you've had a lot of sun today, are you wearing sunscreen, all of those sorts of things. And so that technology is not entirely where it needs to be, but there's work moving in that direction. And we just recently completed a trial looking at whether these devices, whether those notifications can help reduce sun exposure and ultimately reduce sunburns in melanoma survivors. So really, there's a lot of great work focusing on, again, prevention and screening. A whole nother talk about all the great advances that we've made in melanoma treatment. But again, I think the whole world would be in a much better place if we prevented as many of these cancers as we could in the first place. And so with that, I am happy to start a discussion and answer any questions that you have. Thank you.
Thank you so much, Dr. Vogel, for your very informative presentation. I definitely appreciated the reminder of how to correctly apply sunscreen, and as well how to properly do a skin examination as a person of color. So thank you so much for that. So before we get started with our discussion, I'm going to get our fire going. So just give me a moment here. All right.
Oh, I like that.
Yes, it definitely sets the mood for our discussion. So it looks like Dr. Lazovich actually has her hand raised. So Dr. Lazovich, you can go ahead and unmute yourself.
No, I was trying to clap, so for the presentation. No, thank you, Rachel. I think that was a great job. So I'm looking forward to hearing questions from others.
Thank you so much. Okay, so we had just a few questions come in through the chat, and looks like a lot of questions so far are really kind of about just sunscreen ingredients. And so if you could kind of talk a little bit more about that, and like what should people be watching out for?
So really good question. I mean, and frankly, kind of controversial right now. So let me kind of talk you through the two main types of sunscreens, and then ultimately kind of where I land. So there's chemical sunscreens, and that's really kind of what most of us think of, actually. And so the pros of that are that, there is some argument that they work better. They're certainly easy to apply. They're quick and easy. They rub in nicely. The biggest cons of these chemical sunscreens are that it needs to soak in. So like I just discussed, you need about 30 minutes before you go out in the sun. And certainly there's some chemicals that we are potentially worried about, that there's the latest research is showing, not only does it soak into the skin, but it actually can get into the bloodstream. So, people who, the one that we hear the most about is the oxybenzone. And so, but there are plenty of other chemical sunscreens that do not include that ingredient. So the flip side, your other option for sunscreen is a mineral sunscreen. So that's, kind of your zinc. That's when people have the white stripe on their nose, right?
Mhm.
So that's a mineral sunscreen. Those are on top of the skin, so you don't have to worry about that, getting into your body. And they provide immediate protection, so that's nice. You don't have to wait the 30 minutes. It can go on top of your other products, so you don't have to have a clean face. You can just put it on, and it's generally regarded as really safe, particularly for those with sensitive skin. The cons of that, of mineral sunscreens, are that it does leave a white film, and that can be more or less obvious depending on the color of your skin. And that those of you who are, those of us, myself included, who are prone to acne, mineral sunscreens can make that worse. And then it does need to be applied more frequently than the chemical sunscreens. So, altogether, you can see there are some pluses and minuses to both of the sunscreen, both types of sunscreens. At the end of the day, what I personally think, and again, I am not a dermatologist and I'm not your dermatologist, but personally, I think what's most important is that you find a sunscreen that ideally is SPF 30 or higher, that you will use and you like. That is what's most important. So, I think each of us have to kind of weigh those pros and cons. I will say I use chemical sunscreen, but mostly because it's easy, it's accessible, and my kids will wear it. And so, but there's a lot of good reasons to use mineral sunscreens.
Rachel, Rachel, in the chat, there's a link to the Environmental Working Group sunscreen website, and there you can find ratings for every sunscreen that you use in terms of how protective they are, the kind of chemicals they use, and what they recommend, and the criteria that they use for rating their sunscreens are all scientifically based. And so I highly recommend that website. So thank you to whoever posted the link in the chat, but it would be worth people's while to take a look at that to decide the best sunscreens for their use.
Perfect, thank you. Yeah, feel free to click on that link that's in the chat. And then kind of along those lines also about just kind of sunscreen, but kind of should we be wearing sunscreen when it's cloudy, and what kind of protection and measures should we be taking? Should it be dependent on the weather? Can you speak a little bit more about that?
So great question. I mean, so the sun is getting us no matter what, even if it's cloudy. And that's actually an advantage of that device that I was talking about, is that that's more evident. If you're wearing that device, you can see that you're still getting UV exposure. And so really it's ideal to wear sunscreen, wear long sleeves, wear a hat, whatever protection works best for you. Ideally it's every day. And you can pay attention to the UV index and see that, there are times when that is lower, but ideally you're really, again, making this a routine that you're doing all the time. And even if you think about, skiing in the middle of the winter, the sun reflecting off of that snow, it's not uncommon for people to come, back from skiing and they have a sunburned face. So it's not even just when it's warm, but really just being mindful about your sun exposure year round.
Thank you. Okay, so just looking at, and also I do want to actually open the floor to just give people the opportunity. If you want to unmute yourself, feel free to do that and ask questions. So don't feel like you're interrupting at all. But you can also submit your questions via the chat box. So I'm just going to quickly go through here. So how long should you stay out in the sun? Can you kind of talk a little bit more about timing? I know you did kind of talk about that, but if you could just remind us.
So, I mean, any sun exposure is sun exposure, right? So I can't tell you, it's safe to get 20 minutes, but it's not safe to get an hour. It's all going to accumulate. And so, that being said, I go out in the sun myself, right? So I know all of the risks and I do everything I can to protect myself, but we also have to live and enjoy, living in a state where it's only warm a few months out of the year. And so, as soon as April hits, I'm outside too. So, it's about balancing, understanding your own personal risk, right? So being really thoughtful about, for example, my son is a redhead, really fair skin. I am much more mindful of his sun exposure than I am necessarily of my own. And so, it's about your own personal risk factors, and but balancing that with living, and also remembering too that you can potentially think about all the other ways that you can protect yourself, right? So if you know that you're going to be outside all day, because you're going boating and you're doing some fun event, being really mindful about maybe you're going to wear long sleeves and a floppy hat for that day.
Okay. And then also, I mean, you did talk about like the peak hours, but just to give us all a reminder, kind of what are the peak hours of when we should be avoiding sun exposure?
So the peak hours are 10 a.m. till 4 p.m. Really, I would say the strongest is really kind of around noon, but really that whole time is considered peak hours.
Thank you. Okay, so do you have any recommendations for FPS clothing brands that you can recommend?
So that's a good question. So personally, I buy Colabar, but that's actually not necessary. So a dermatologist that works with me is very quick to point out that all clothing can is protective and is helpful, right? So you don't actually have to buy the particular SPF clothing. Really any long sleeve shirt or long pants is helpful. But I do personally, I like Colabar. It's a Minnesota-based company, and they have some nice, lightweight. I mean, I think that's one thing to keep in mind actually, is that you can imagine you can get really hot if you're wearing long sleeves and pants, on a 90-degree day. But they have some really nice lightweight clothing that you are covered, but you don't get as hot.
Okay, thank you. So what should you do if you feel like there's something itchy on your back, but you can't get an appointment to see a dermatologist until, a few months out? What do you advise people to do in that situation?
That is so tough. It can take a long time to get into the dermatologist. You could talk to your primary and meet with your primary, but they're still going to send you to a dermatologist. The one benefit of that is that maybe if your primary doc is also concerned, that they could push for you to get in faster in dermatology. I also recommend they always have a wait list, and I do this myself. So ask if you can be put on the wait list so that if there's a cancellation, that they will call you and you can get in sooner. But that certainly is one, that is one issue that it can take a while to get into dermatology. I guess that does remind me, one thing I do, I know this sounds really silly, but it works for me, is I go for annual checks. Not everybody needs to. It's something I do for my peace of mind. I go for an annual check, and I always schedule it as when Valentine's Day comes, because it's really easy for me to remember, like, hey, I love myself and I want to go get a skin check. And so I that's when I schedule it every year. But when I call, I know it's going to take a couple months to get in.
Oh, that's a really good tip. And I think just also stressing the importance of constantly seeing a primary care provider, also because some of these specialties do take so long. Okay, so actually I was going to ask this question as well, but so you talked about, just tracking moles over time. Do you have any tracking apps that you can recommend?
So that is a good question. I don't off the top of my head, primarily because the technology changes really quickly. So, I know there was an app I was using a few years ago, but because it was part of research, it's not available right now. So that is a really good question that I think I don't have an answer to right now, but I'm happy to find one. So you can email me and I will track down some of the better apps. But again, I think it's also worth talking with your dermatologist, because some of the, like I said, some of the dermatology clinics do use a specific app or recommend a specific app. And that would be really helpful to know if your dermatologist, prefers something in particular or has had good success with a particular app.
Perfect. Okay, so another question that came in directly to me, and sorry, my internet is unstable, so if I freeze or I get booted out, I'll come right back. So looks like someone is asking about, and if you can speak on this. So why do you think there are high incidences of melanoma in Japan? This particular person states that they've heard that this can originate on the bottom of one's feet, which doesn't suggest the cause for sun exposure.
So that type of melanoma is called acromelanoma. So where it does not originate, or it's not due to sun exposure. I'm not familiar with what is happening in Japan and if they have higher rates of acromelanoma, for example. We don't have good data and good ideas about risk factors for that, but it's incredibly rare. And so it's understudied. And so there's some work being done by the Melanoma Research Alliance to gather more data on these rarer melanomas. So acromelanoma and then ocular melanoma, so melanoma that occurs in your eye. Those are very rare melanomas. And so, there's international efforts really to gather these data for us to be able to have better understanding of these risk factors. So I don't know more specifically about Japan. I know, for example, Australia has the highest rates in the world, and that's primarily due to their UV exposure. And so I think that's probably the best I can do with that question.
And just kind of along those lines about some of the non-modifiable risk factors that you had talked about. So how do you best mitigate predisposition to sunscreen due to family history and medication for any autoimmune disease?
Right. So, I mean, in this case, I mean, as I tried to reiterate, the recommendations for prevention are the same regardless of your level of risk. However, if you know that you're at higher risk, I think it's really about taking those as seriously as you can and making sure that you're doing regular, more frequent screening. So my brother-in-law is a kidney recipient 2 or 3 years ago. And for Christmas every year, I get him new sun shirts. And that's something that we're always talking about. And he has much more frequent visits with the dermatologist than me, for example. So it's really about balancing, doing as much of the protective behaviors as you can, but really also just being mindful of screening and catching those cancers as early as you can.
Thank you. And then before I go into some of the questions that came in through the registration, I want to again give the opportunity to all of you here today to unmute yourself and ask questions. So please feel free to do that. Just know that you have the opportunity to. Okay, so if nothing is going to come through, I'll go through some of those questions. So speaking of screening, when do you recommend people to start full body skin checks? Is there an age?
That's a good question. So if you were to Google that, you would see all kinds of different answers. Everybody has different opinions. Again, I would say it's really risk-based, right? So nobody is going to turn you away if you go to a dermatologist. If you're 25 years old and you show up, they're not going to turn you away. They will absolutely do a skin check. It's really being mindful about those risk factors. So for me personally, I did start at 25. One, because I was doing this research and I got nervous, but also, I also was an indoor tanner growing up. And so, so I know that elevates my risk. And so, it was important to me to go kind of have that baseline check with a dermatologist. I would say, generally speaking, before 40 would be great. But again, if you have more of those risk factors, earlier is better.
Perfect. So can you tell us are there any ways to reverse sun damage?
Again, a great dermatologist question. So, the best way to reverse it is to just not have it happen, right? To prevent it as much as possible. And even once you have skin damage, any prevention that any, sun avoidance and prevention exposure that you're doing is going to help not make that worse, right? So that's the first thing I would say is, the most important thing is prevention, prevention, prevention. If you do have sun damage and you are again, talk to your dermatologist. There are retinols, serums with antioxidants, vitamin C. So there are some options, and there's like there are chemical peels and all of those things you can do, with a dermatologist. But again, this is a case where discuss it with your dermatologist and do everything you can to reduce that sun exposure.
So prevention is key. I hope that's what everyone kind of takes away from today's conversation. Let's see here. So I know you talked about kind of just any like other products and things for people to use to prevent or to minimize appearance of sun damage. But do you have, besides sunscreen, do you recommend any other skin products? I know you kind of briefly talked about that, but do you have any specific skin products that you can recommend?
So the only thing I recommend that I personally use is a moisturizer that includes sunscreen in it. And so that for me, that's really primarily what I use. And again, really trying to remember of that sunscreen and all of these products are really secondary to being in the shade, clothing, hats, all of those other pieces. So I think really it's about shifting our mindset of having sunscreen be secondary.
All right. Are there any other questions from all of you here today?
Do you have any suggestions for cancer survivors and people who are dealing with breast cancer now to safeguard themselves against additional radiation from the sun?
So great question. So again, it's really those same things, but just being extra mindful, right? But truly the recommendations are exactly the same for the general population, through to melanoma survivors. We don't tell them anything different than what we try to tell the general public. It's really just that we hope they take it a little more seriously. But really the recommendations are, from the CDC are exactly the same.
Now is your opportunity, because we went through our registration questions. We had a really good discussion based on the questions that came through. So please feel free to ask any questions while we have Dr. Vogel here with us today. Okay, I don't see anything coming through. So we certainly can wrap up early. But before we do, I know you talked a lot about prevention as being key, but what is one final takeaway? And it could be something that you've already stated, because I think getting reminders is definitely helpful, but one key takeaway that you want everyone to kind of just take with them today.
So, I mean, I think everybody will leave with my prevention message, right? So, I do want to really, just reiterate the importance of screening, particularly for melanoma. When we can catch it early, it's not simple, right? But it's a surgery and it doesn't involve other therapies. Once you move into those more advanced stages, when you find melanomas late, it really is a pretty deadly disease, and which it requires a lot of treatments that lead to a whole bunch of other side effects too. So really, this is a scenario where we know how to prevent, we know how to screen, we can find these things early, and that really makes a really big difference.
Okay. Well, Lovely. Thank you so much, Dr. Vogel, for just taking the time to join us today and to help us raise awareness about skin cancer as we approach our warm months. So you will receive an email shortly following today's session with just the link to complete a quick survey. So we would really appreciate it if you could take a few minutes to provide us your thoughts and feedback about today's session, because it does help us shape future programs. And after completing the survey, you can enter to win a swag bag filled with Masonic Cancer Center goodies. And the $5 Amazon e-gift cards will be emailed out to all non-University of Minnesota staff, students, and faculty in a few days. And then also, before we wrap up, please make sure that you follow the Masonic Cancer Center on all of our social media platforms to stay up to date on our future announcements and find out what the Office of Community Outreach and Engagement is up to next. So we are approaching our busiest months of the year, so we will be out in community. So just follow us on social media to kind of find out where we will be. And then again, thank you everyone so much for joining us today. And I really hope that you kind of learned from today's session and can really protect yourselves and your loved ones this summer. So have a wonderful day, everyone. Thank you so much for joining. Take care.
Thank you. Thanks, Damna.
Bye-bye. Thank you, Dr. Vogel.